Hi, everyone. Welcome to the MIT COVID-19 Challenge, Beat the Pandemic 2. We're so excited that everyone is here with us tonight or this morning, whatever your time zone is, and getting ready to hack away. We're really excited to have you here. And we're excited for our returning teams as well. So we just wanted to give you a little bit of a review over what we've done. Let's find the video. This slide's not.
On April 3rd, in the midst of the COVID-19 global pandemic, 1,750 volunteers from 49 states and 96 countries gathered remotely as part of Beat the Pandemic, the second event in the MIT COVID-19 Challenge.
This was urgent. With the virus spreading so widely and so rapidly, our goal was to ideate quickly so that we could implement solutions to an array of problems associated with COVID-19.
The 1,750 volunteers represented two groups, 1,500 hackers and 250 expert mentors. The operations team consisted of over 25 volunteers, and the event was also supported by more than 50 partner organizations.
The response was overwhelming. Overall, there was 4,500 participant applications from clinicians and healthcare providers from the front lines to the engineers and the scientists and the user designers, programmers, coders, payers, and patients.
The hackers split into 208 teams, distributed across 10 tracks, each with a specific focus.
We coordinated with our clinical partners to design these 10 tracks. The tracks represented 10 problems we felt were best suited to a hackathon-style challenge and fell into two main areas. The first, how to protect vulnerable populations, and the second, how to help health systems.
48 hours later, 199 potential solutions.
We were blown away by what the teams were able to put together over the weekend. By Sunday afternoon, there were hundreds of thoughtful and specific solutions.
$20,000 was awarded to the 40 teams with the most promising solutions.
We're giving the teams the resources that they need to continue refining their solutions and hopefully begin implementing them. That's the goal. Having the idea is just the first step. The money and strategic partnerships that we facilitate are to help these teams reach the next step.
You know, at MIT, hacking has always been in our DNA, but we've never done a virtual hackathon on this scale to meet head-on such a global, critical, unmet need, especially with an eye towards rapid innovation from ideation to impact. Beat the Pandemic was a huge success by all measures, and we're excited to see what comes next as our hacking teams make an impact now, tackling today's most pressing problems.
Great. So once again, welcome everyone. And I would like to introduce Freddie Nguyen, who is our director for this hackathon, and he'll be introducing our keynote speakers for the night and also telling us a little bit about who all applied and from where.
Hi, well, thank you, Hannah, for getting us kicked off here. So a big welcome to everyone who's here tonight. My name is Freddie Nguyen. I'm a resident physician at Mount Sinai Hospital and a postdoctoral fellow at MIT. And the MIT COVID-19 Challenge came together as an initiative that was born out about a couple months ago between a few of us in the MIT community about needing to come together to solve some of these challenges that COVID-19 was bringing about. A little bit about this event that you're all embarking on is the Beat the Pandemic 2. which is really the second round of the Beat the Pandemic, but this is really now the fourth or fifth event now that we've done as part of the challenge. And in less than 2 weeks, have had equal success as our prior events, really garnering the world together as part of this event with over 2,000 participant applications from 89 different countries and 40 states across the US, and over 430 applications from mentors that really represent the full spectrum of the healthcare ecosystem and beyond. Next slide. Yeah. And from there, we selected 1,800 participants. Go back, please. 1,800 participants, 200 plus mentors, and over 70 partners that have come together as part of this event. What's unique about this particular event is that we've added 2 of the tracks that are focused on 39 of the returning teams from Beat the Pandemic 1. And it's really to give them an opportunity to have another intensive sprint at accelerating the development of their ideas and their solutions. Next slide. And so the first event was held a little less than 2 months ago. So I think all of those returning teams are now their 2-month mark. And I think back then we were able to garner quite a number of partners as part of them. Some of them have been very diligent after the event, post-hackathon, to work with these teams. And this is what we've tried to do with each and every single one of our events, is to have a coalition of partners that are equally dedicated to work with you, the participants and the hacking teams, not just during the event, but after the event, whether it's in terms of mentorship, whether it's access to resources, of funding, or experts that can help you accelerate your process. Next slide. And then the next big event that we had was about a month ago, and it was similarly, trying to now tackle what was happening in Africa. This was right around the time where, those surges were starting to come up in Africa, and there was a real serious concerns about how to address the upcoming issues that we're facing Africa, in particular because now, one of the things that we always talk about within our hackathons is really making sure that we take into account the context of the local ecosystem. And this was certainly a case of that, because the solutions that were being developed out of the first hackathon were not necessarily as really potentially relevant within the African continent. Next slide. And then about a couple weeks ago, we also worked with a group, several groups at MIT, to put together a datathon. And that was really targeted at really trying to make sense out of all of the data that was now out there. And how do we make more meaningful data? Sorry, excuse this here. And can you go back, please? And it was very targeted at taking all that raw information and making more meaningful information that we can use to really inform our decision makers, to really inform not just clinical decision makers, but policy decision makers. And that was really the goal of the datathon. And really the goals out of all events is not just at the ideation stage in terms of bringing together diverse teams to hack around particular challenges and problems, but also targeted at really bringing those ideas to action or to implementation. And so I think, unlike a lot of other hackathons that are out there, really our focus is really to bring those ideas to action. And that's why we've worked with clinical partners in that sense, and our partners worldwide. And as you can see from this event, our partnerships with various entities continues to grow both inside the hedges at MIT, as well as beyond our borders, outside of MIT and across the globe together. And these really represent all corners of the ecosystem, everything from the academic part component, academia, to healthcare systems, hospital systems, to governmental agencies, to incubators, accelerators, to venture funds, really the entire spectrum. And so they're all here with a common goal and sharing in our common mission to not only ideate and develop ideas and bring teams together to work on these problems, but to really take these ideas into implementation. And so without further ado, I'm going to kick it off with two of our speakers, and I'm sure if Dr. Wu is on the end, but we'll start off with Esther Dyson, who will kick off with, who's the executive founder of Wellville. She's well renowned as an investor, journalist, author. Gone through basically has worn every hat that hopefully someday some of us might wear as well. So Esther, thank you so much for taking time out of your busy schedule to talk to us this evening. And I'll turn it over to you.
Someone needs to unmute me.
Yep, we can hear you.
Okay. Okay. Hi. Okay. Sorry. I was muted and disappeared, but I'm back. So my name is Esther Dyson, and I'm really delighted to be here this evening or morning or midnight, whatever, to welcome you all here. I would like to set the context a little for what you're about to do. This isn't going to be long because we're slightly behind time already. But I work in 5 small communities around the US that are the kind that are not prepared for coronavirus or for almost anything else. They're poor, they're underserved, they have, depending on which community, large minority populations. And these are the people who, if some of them are rural, so they're not as affected, but these are people who do not have the resources, either physical or mental, to deal with COVID-19. We talk at MIT about technical debt. There's a lot of this country and a lot of this world that has social debt. So what I'd like to do is tell you what I've discovered in the last 5 years of working in Wellville, which is a 10-year project, and then explain how important the effort you're taking on this evening is. Because you're not simply looking at problems and you're not simply looking at solutions. You're trying to understand the broad challenges. And that's really important, because COVID-19, while it's a pandemic, is also a symptom of what's wrong in the world right now. We have become a society that is short-term oriented and is not investing enough for the future. So what I discovered in the last 5 years is the role of addiction. We think of addiction as just being about drugs, but it's actually about people's response to an obsession with things that on their own are good. Dopamine is good, Facebook is good, food is good, sex is good, money is good. But when you become so focused on something in the short term that you just need more of it, and you forget to think about the long term.
Want to see something cool?
Absolutely.
Can someone go on mute, please? That creates a society that underinvests, whether it's in medical care or in health itself, which is the health of children, education of people, so forth and so on. So what I hope you do this evening and for the next 2 days is think about how you can solve this short-term problem in a way that will leave society better equipped for the long term. So don't just give people food or provide medical care, but train people to provide health, not just medical care. Help people build up a medical system that's going to make us less vulnerable and more resilient for the next pandemic. Help us design systems that keep our children healthy, that educate our workers. Contact tracing is a great example of the kind of work that is both providing care in the immediate. You go out to somebody and say, I see you're sick, let me help you, let me find you the care you need, but then let me also find out who you've been talking to so that they don't get sick too. That's kind of two for the price of one. And many of the challenges, as I looked through them this afternoon, are very much focused not simply on solving the immediate problem, but on building something that is going to last long term. And so the goal ultimately is not just to deal with this pandemic, but to make us more resilient and less vulnerable to the next pandemic. So I thank you all for coming. I wish you help. And I'm glad to see you invest in the future rather than just spend on fixing the present. Thank you very much.
Thank you so much, Esther, for those inspiring words. I think it goes a long ways towards, grounding us in what we're here to do this weekend and hopefully in the next few weeks and few months moving forward. Our next speaker is running a little bit behind, so we're going to shift to the next part of tonight, which is to briefly go over the various topics and themes that we're hoping to address, that we're hoping you all address this weekend as part of the hackathon. And so with that, we're going to have each of the track leads that are part of this event, so that way you'll also be able to put a face to name as the head of your track leads. So roughly we have been, unlike our first event was really focused on the near short-term issues that were happening as part of the rising issues around COVID-19. Many of our communities now have started to shift past the peaks that we were being overwhelmed with our various healthcare systems across the country and across the globe. And we've now focused on two areas, which has been, the first is on the recovery and reopening, and especially as many of our communities are now moving past the peak infection rates, how can we start thinking about moving our communities and organizations safely and effectively to a return of new normal. And under that, we have 4 tracks. The track A, which is the new surge, treating non-COVID patients. Track B, which is our overall well-being on an individual basis and how to adapting to the new normal. Track C is growing up and educating the new normal, especially for our kids and young adults whose schools have been shut down. Track D is really addressing the healthcare disparities that we always knew were there, but have been much, much further exacerbated as part of what has happened with COVID-19. And our second category of themes has been around predict, prevent, and prepare. And really, this is as we start thinking about the future and the rest of the summer and heading into the fall, our concerns about how, as communities start to open up, the risk for reinfection, or in the fall as the conditions become more agreeable towards the virus coming up again, and sort of the second surges that we've all heard about. And some of those areas that we've surfaced and on where track E is focusing on surfacing and communicating the COVID-19 truth and really how to get that information to the top. Track F, which is still focused on testing, which we've all heard about as being one of the central aspects of reopening, and also thinking about not just testing active, but also whether people are recovering from these infections. track G, really looking at where are these new hotspots of infections really coming from, so the nursing homes and assisted living facilities. And track H, which is the right place at the right time, our continued fight and having the right medical equipment or other essential equipment and supplies at the right place. With that, I'll have Fatima, who is the track lead for track A, to talk a little bit more deeply, more in depth about that track.
Hi, I'm just waiting for my video to come on. But if it's not going to come on, I'll just start. Hi, I'm Fatima Klauser. I'll be part of track A this weekend. Pleasure to meet you all. And a little bit about myself. I have a background in biomedical engineering, and I have worked on ophthalmic clinical studies as well as developing tools to be used in ophthalmology clinics. So that's just a little bit about me. So I'll just dive into what track A is all focused on. So because COVID-19 has reduced the need for preventive medicine, annual checkups, heart attacks, strokes, and trauma, and as the capacity of our health systems continue to scale back from a focus on direct COVID-19 patient care, we must ask ourselves, how do we reshift our attention to the new surge of patients seeking non-COVID related healthcare? And how do we convince patients that it is safe to seek non-COVID care at our hospitals and clinics without fear of being infected by COVID-19? And lastly, how do we continue to strike a balance between in-person visits and telemedicine?
Thank you, Fatima. And track B, we have David.
Hi, everybody. Can you hear me? Hey there. So yes. Track B, we are focused on the big elephant in the room. COVID has really, as Esther was saying, and as also Freddie was mentioning, exacerbated a lot of the problems that we had even before it. And with track B, what we're looking at is how has COVID really increased levels of stress, anxiety, depression, PTSD around our society. And my background, this is a really important matter to me because I suffered from it myself, from mental health and addiction, various forms of addiction, that is. And I'm a serial entrepreneur. I started coding when I was about 8 years old as a result of bullying. Co-founded 2 companies, sold them, made a bunch of money, and then I ended up homeless by my 30th birthday after I discovered drugs and heroin and everything else. So this is something that to me is extremely important. And my latest venture, we're working on something that is trying to help reshape the way that addiction treatment is conducted in this country and in the world by making it more data-driven. So what we're going to be focusing on in track B as a team, and we have some great people from all over the world that have come in to join this track. We're really focused on how do we rebuild and recover, and also how do we protect the well-being of those around us, both our loved ones, our colleagues, and finally, how do we achieve this balance of emotional, mental, and physical well-being? And the most important part of it is how do we do this society together? And I'd like to introduce just briefly my co-lead, Anne, who's on the call here.
Yeah, so I'm Anne, and I will be supporting track B as well. As you guys know, I'm also really interested in mental health, and it's something that I'm really passionate about. So that's one of the reasons I picked track lead for track B. So it's really nice meeting you all, and right, see you guys in a minute after that.
Thanks so much, David and Anne. So next we have track C, which will be led by Dana.
There we go. Hey guys, I'm Dana Attar, and I am on the team lead for track C. When we're focusing on recovery and reopening, and specifically around the growing and growing up and education in the new norm that we're in. So we have been, forced into remote education, homeschooling, and sometimes lack of. We swap teachers with parents, and we are losing the social aspects of what helps us to grow up and mature as individuals. So what we're trying to solve here in Track C is, how do we build solutions to mitigate these paradigm shift and decrease the exacerbated disparities due to different learning and teaching styles, and also assist in social and physical and emotional development of children and young adults. And although my background is in healthcare technology and digital health, but this is a very important topic for me, because although this is such a hard time that we're going through for short-term solutions, but I really worry about the future of our generation of growing up and the level of education and maturity that they will receive as we move forward after this situation. So looking forward to meet our team later tonight at 8:30, and welcome to Track C.
Thanks, Dana. Next, we have Track D, which will be led by Danya.
Hi, everyone. My name is Danya Day, and I'm a physician scientist who was recently on the front lines of the COVID-19 response. I also do some work in the diversity, equity, and inclusion space. For this hackathon, I'll be the track lead for Track D, Healthcare Disparities and Protecting the Vulnerable Populations. And in this track, we're going to be trying to answer a few questions, specifically around how do we build solutions to prevent new spread of disease among the most vulnerable, so specifically underrepresented minorities, immunocompromised, those with comorbidities, those with limited English proficiency. We're also going to be looking at how do we support populations that might be silenced, whether it's due to disability, domestic violence, limited English proficiency, or poor health literacy. And now, as we're all seeing from the events currently transpiring, also distrust in the system will be one of those issues to address. And how do we mitigate healthcare system distrust and ensure equity in care access and delivery? I'm looking forward to meeting everyone in Track D very shortly, and welcome everyone to the hackathon.
Thank you, Danya. Next, we have Track E, which is being led by Jesus.
Yes, hi, how are you? Here is Jesus. I am from Bayer, the pharmaceutical company based in Berlin, and I am a physicist and have a PhD in biology. I am extremely interested in this track. I mean, we are living extraordinary times, right? In these times, these days, one single person is able to disseminate information to masses of people, and it doesn't matter, you cannot check it, you don't know, is this the truth or it is just something that somebody speculated on? We want to look which information is coming really from the brain, which is evidence-based, scientific, which there were scientists studying this data and getting to the truth that we want to know. And then we have a second problem, because communication is always, it consists of two people. There is the person that speaks and the person that hears. And the most important part is actually the person that hears you. How do we bring this information to the people? Some people are scientists, talented engineers. You can talk to them with data, with numbers, but the majority of the people, you cannot. You need to bring them this science that your brain discovered with your heart. You need to reach them. And these are the problems that we are going to tackle in Track E. Welcome to Track E. I am very, very happy to be with you this weekend.
Thank you, Jesus. And then Track F is being led by Tim.
Hi, everyone. Tim Barrett. I'm an innovator, disruptor, and educator, primarily in healthcare in Boston, Massachusetts. I have a passion for entrepreneurship and human-centered design. I'll be on the lead and for Track F. So Track F, as Freddie was briefly stating previously, is all about, you know, as we're starting to reopen, and testing is still a large priority. What's the availability and administration, you know, of this testing to get to a safe path and get back to some normalcy. So, however, there's obviously some areas that are not only lacking adequate testing capacity, or there's access issues, and some of the tests aren't as good as others in terms of the accuracy, sensitivity, and specificity. Obviously, when you're thinking about the inequities as a whole, and health disparities that have occurred during COVID. But as a result, the test results need to be rapidly and easily shared across organizations, businesses, and schools to facilitate a safe reopening. So what the challenge is really how can we continue to improve the systems and technologies used for determining active COVID-19 infections, as well as exposure and recovery from COVID-19. And secondly, how can we improve testing capacity, increase access to reliable testing, and improve data sharing of all these testing results. So happy to be here and looking forward to Track F killing it this weekend.
Thank you, Tim. And then the next track is Track G, which is being led by Alana. We have us, Alana, from Track G. Well, Track G is really, as I mentioned in the beginning, focus on the new hotspots that are coming about, especially the nursing homes and assisted living facilities that we now account for more than 42% of all the COVID-19 related facilities in the United States. And they've really become the new hotspots of these outbreaks and facing an already vulnerable population and even higher risk. And you know, as much as we did our best at discharging patients out of our hospitals back into the nursing homes, it seems that it's now created a new area for the virus to spread further. And so how can we better identify and develop solutions that are affordable and effective to really address these challenges of not just the nursing home and assisted living residents, but also the employees and the healthcare workers that take care of them, and not make this another node of infections that then further propagates? How can we, you know, essentially also help protect the respective families from contracting or spreading COVID-19 from this population? And next we have Track H, which is being led by Rachel and Sai.
All right. Hi, everyone. My name is Sai Rajagopalan. I'm one of the co-leads for Track H. So this track essentially has to do with how we can help the supply chain that has been disrupted by COVID-19 significantly. And because of the pandemic, as well as the associated shutdowns, we haven't been able to get the resources that we need to the right places. So the focus of our track will be effectively to figure out how we can improve resource distribution and reduce the inefficiencies that COVID-19 has caused all over the world, and how we can effectively reallocate resources from areas that have low need and a lot of resources to areas with high need and low resources, either within a single hospital, within a health system, or even across countries.
Thank you, Sai. And with that, we have two more tracks, so tracks I and J, and really these are tracks dedicated to the teams that are been working for the last 2 months since the first beat the pandemic. And let's have Paul and Stephanie.
Hi, everybody. My name is Paul Cheek. I'm the hacker in residence at the Martin Trust Center for MIT Entrepreneurship, and I am very excited to be leading Track I with Stephanie leading Track J. We are really excited because when we started the MIT COVID-19 Challenge, we weren't looking for folks to join us who really wanted to just work for a weekend. We were looking for individuals who wanted to take what they developed over the course of a weekend and continue developing it. And in order to foster that, we've provided all sorts of different resources and mentorship since the first Beat the Pandemic Hackathon. And we're really excited to welcome 40 continuing teams into the second Beat the Pandemic Hackathon to continue developing the solutions they began over a month ago and have some other individuals join their team as well. And Stephanie, is there anything you want to add?
I think you covered it. We're going to be in the same room for our problem pitches shortly. And so we've got all these awesome new folks who are going to come in and supplement these teams. So it's an awesome way for them to catapult forward. And yeah, we're excited to be part of the continuing teams tracks.
Thank you, Paul, and thank you, Stephanie. It'd be great for especially those of us who are involved with the first event to really see that leap forward that a lot of these teams have made in that short period of time of less than 2 months. So supposed to have our next keynote speaker, Dr. Rue, but he's running behind. So with that, we're gonna jump into really what is we call Hack 101. Is really an expectation of what is going to happen over this coming weekend, what you should expect out of it. Hacker Medicine, which is one of our partners as part of this, has really had a mission of democratizing healthcare innovation through the use of healthcare hackathons, especially from a design thinking and user-centric perspective. And as I alluded to earlier in the hour, what sets us apart from a lot of the hackathons that you've seen out there? I mean, one has been, as you've seen, the series of virtual hackathons and events that we've done to stay very focused on, hyper-focused on the problems and needs at that period of time, and trying to stay agile and recognizing that, the problems of today hopefully are not the same problems that we'll see a month or 2 months downstream, but vice versa, the upcoming or more pressing problems 1 or 2 months downstream may not even be on our radar today. But in addition to that, and as some of you as participants have already guessed in terms of as you've been onboarded onto the Slack workspace, is that even the structure of our hackathon is different. We really highly value the diversity of individuals that we bring at our events. And it's not just from a geographic perspective, as you saw from the maps that we showed earlier, but from a background perspective, life experiences perspective as well. We have individuals who are as young as high school students or younger, all the way into their mid-50s or older. We have people who are physicians, clinicians, scientists, engineers, patients, payers, user designers, programmers, coders, really every type of background that you can think of. And the way to think about this, especially as you're building out your teams tonight, is that it's the value of those diverse perspectives from the very beginning in terms of code definition of the problem to code development of the solution to code implementation and execution of those ideas. That is how important, because now you're no longer working in silos, but you're working knowing all the different perspectives and constraints that each of those groups bring to the table. The second is the design methodology. So staying very true and centric to the real problems at hand that have meaningful impact and are coming from real people. And so through this event, we hope to empower participants to really build solutions around tangible experience that they've encountered, or they've heard from their colleagues or from their family members or their friends and others in their community. The third part is the viability or feasibility of the idea. And from this perspective, it's not, as was mentioned, really we have a mission to do innovation, rapid innovation from ideation all through implementation and impact. And so the viability or feasibility of your idea from not just how well does this idea work, but how is it going to be integrated into the existing workflows, into the existing ecosystem, infrastructure? Is it going to be a low lift, or is it going to be a heavy lift, and how do you overcome that? So thinking about that from a infrastructure and workflow perspective, also thinking about it from a financial perspective in the sense of how is it going to self-sustain itself and pay for itself? I saw a lot of questions on the side, whether did this have to be a solution that actually makes money or not? And certainly, it's not one of the primary goals. When we talk about viability and feasibility, we really want to make sure that you think about how does these solutions become self-sustaining, not just from I'm going to keep applying for grants and having donations support the idea, but having something more sustainable. And then the fourth is the community. As much as we would love for every single one of these ideas to continue for days, weeks, months after this weekend, we realize that there's a multitude of reasons about why ideas or why teams are able to progress or not progress. And so we hope that through these events that we put together and through the activities that we do after the event, that we are fostering a community of innovators and entrepreneurs and problem solvers, change makers who will take some of what they've learned throughout the weekend, who will take some of the network that they've built throughout this weekend with the teams that they've worked with or the mentors they've interacted with or the partners they've worked with, and continue on that path to solve and address some of these issues and problems. We consider it success if you're able to take those principles and work on a whole new problem or work on a whole new different solution that addresses the same problem that you were highly motivated to work on this coming weekend. And so for us, hacking isn't about the traditional sense of gaining unauthorized access or breaking into things. But really for us, hacking is a creative application of ingenuity. So we really want you guys to think outside the box and really bring any ideas that you have to the table. And don't be so quick to shut down those crazy ideas that are coming from other parts of your team. As mentioned, our hackathons at MIT are different from the traditional hackathons that you may have heard about. They're more software development based. So there's not a requirement to code. It's a very highly interdisciplinary group of people that are being brought together, and that's should seek for that same interdisciplinary nature in terms of the teams that you're building out tonight. Also, as mentioned, being very centered around problem-centered and meeting the real user needs. And as also mentioned, the feasibility and the business viability are critically integral to the solutions that you develop this weekend. Hacking Medicine has been doing hackathons over almost nearly the last 10 years, and for 200 of these hackathons all live. And so this has been our first foray working with partners like the COVID-19 Challenge to bring on virtual hackathons. It's been a learning lesson for all of us as well. So just briefly, what does an MIT hackathon look like? And give you an overview of what's going to happen. They, of course, used to look like this, but as you might have guessed, now they all look like this in terms of the propensity of Zoom rooms that we've all now become accustomed as part of our new normal. So briefly, the process is that tonight, we'll have problem pitching. And so for the people who are joining those 8 tracks that we just talked about, there will be 8 such tracks, and each participant will have the opportunity to pitch in 45 seconds a pain point or a problem that you see. These don't need to be super well fleshed out. It's just about getting the problem statement out there and trying to see who else is interested in those problems and issues and to start building a team around. There'll be a sort of virtual mixing that will happen in which the team, the various participants will now try to talk to each other and congregate around those problems. And then once you've got your team forms, which should be 4 to 7 team members, you'll start doing the hacking. And that will start as early as tonight to all the way into Sunday morning. And throughout that process, we have a wealth of experts and mentors that are coming in. They will, I think we have over 200 or 250 mentors as part of that process, and then over 70 partners for you to be able to engage with, to test and validate your concepts and ideas, to help you build out if you're going more of a digital health route or an app development to do that. And so highly, highly encourage you guys to continue to iterate on those ideas and those solutions. Seek out that new input, incorporate it into what you're building, and continue to iterate until you get that next best idea. And then lastly, on Sunday is your final, it's the final presentations on Sunday afternoon, which you'll have to present in 3 minutes what you've worked on over this weekend, really focusing on telling us, why is this an impactful problem, what the problem is you're working on, why is it so impactful, what is the innovative solution that you've built out over this weekend. And we highly encourage you that, as much as you can, be active in building out your solutions this weekend. Don't just sit around and talk the entire weekend. And then, of course, in the last part of that presentation, addressing the implementation, or essentially what will you do after this weekend to bring this idea to bear into fruition. And so just quickly, as mentioned, problem pitching later this evening, hacking or mixing, and then hacking through the weekend and getting that feedback from the mentors and experts, and then again, iterating as much as you can. And then finally, that final presentations. And just a couple of hack do's and don'ts. And you've heard me say this before earlier. The hack do's is open yourselves to crazy ideas. Really leave your job titles at the door. Really, this is about the best ideas coming to light and coming to the top. Seek out very, very diverse teams. This is also part of the judging criteria as well that we seek out as well. Don't be afraid to reach out for help. There's a wealth of expertise and experience, not just within your own teams that you're building out, but across all the participants, across all the mentors and the partners, and even our own MIT organizing team. This next point of fail fast and often, as you've heard me say this before too, is iterate and pivot. Give due diligence to the idea and testing it. But if you're hitting a wall and you're seeing it's not going anywhere and that idea doesn't have any more traction, go seek out the next best solution to address that problem. Again, stay very, very focused on the problem and solving that problem, not what new piece of technology you want to bring to light. And then lastly, really be active and build something, whether that's a piece of code, whether that's a mock-up, a prototype, wireframing. Really do things actively to give us more credibility in terms of the traction behind your idea. Some hack don'ts is don't worry about patenting. And as you know, this whole event is an open source license, and so really to help foster that open environment. It's also too early to even think about talking about patenting or ownership at this point. Don't develop too broad of a solution. So similarly, as we're going to push you to really focus down on the problem that you're going to be working on, you're going to have to do the same thing about the solution. So really make sure that the solution you're building is truly fixing that particular problem you decide to focus on. And it's going to be a continuous cycle going back and forth between the problem definition and your solution development. Don't be negative and don't be shy. Really make sure that everyone on your team gets a chance to contribute effectively to your team. And if you're saying that people are not being team players, or they're taking a little longer to come out of their shell, bring them out of that and make it a welcoming environment for everyone to contribute equally and effectively. So in that sense, also don't monopolize the conversation as well. And as mentioned, don't only talk, but take action and try things out. Try and test and validate your concepts and ideas. Do user surveys, go out into the community, talk to individuals. And a good hack is based on a good story that meets a real need. And it's a problem that can be iterated, and a solution that can be iterated and scaled and tested. And so just to recap, again, identify the problem, break down that problem, brainstorm for solutions, and continue to iterate and improve. And with that, I say that one of our keynote speakers, Dr. David Rue, has been able to join us. Dr. Rue is the Chief Medical Officer and the Vice President of VP of Healthcare at Microsoft. And with that, I will turn it over to oops. There we go. Dr. Can you hear us?
I can. Can you hear me all right?
Yep.
All right. Well, hey, it's a real pleasure to be here. Thank you, Freddie, for inviting me. I've spoken at this event before. I think it's a fabulous event, tremendous amount of innovation. Really excited to be able to see what we can do together. One of the things that I wanted to do was just to highlight in this setting that we're in, which has been predominated by COVID, there's a few things that have happened that I think are pretty interesting, which is in many ways accelerated things that we have known to be important, whether it be telemedicine, whether it be kind of ways that we can better bring some of these thoughts and ideas to life. And it's really about accelerating the pace of innovation. So what I'd like to share with you are some of the things that we've seen at Microsoft. As you're well aware, we're a global company. We've we're in every country in the world, have seen a lot of some of the needs, but also we've tried to lean in. And so I thought just simply by sharing some of our experiences, it might give you some ideas, some inspirations, and hopefully help you on your journey. So why don't we move on to the first slide here, and I'll jump right into this. You guys have my slides?
1 second there.
So while we're waiting for the slides, I'll just tell you a little background on myself. I'm a physician, I'm an internist, I'm also an infectious disease doc. I did my training in the era of AIDS. In fact, took care of many patients at the time that in many ways is very reminiscent of what we're doing here. We're in the middle of a pandemic. There's many similarities in terms of the need to collaborate and to learn and to innovate and to accelerate the pace of innovation. But also there's some unique things. This virus is different. It's highly infectious. It's one that we need to start thinking about how we can better enable not just treatments, but also implement processes around isolation, social distancing. And so this has become a major topic of focus, not just within the healthcare community. And we're now starting to see some of the dramatic impacts this can have on the economy and even mental health and well-being. So this has become pervasive throughout our lives, throughout our culture. The things that we're looking to develop here as part of this COVID-19 challenge at MIT is going to hopefully allow us to be able to accelerate the pace of bringing those type of innovations to help those in greatest need. Freddie, would you like me to share my slides? Is that kind of how you'd like to do that? Okay. Well, then in that case, then let me go to my slide set here.
Okay. Sure why we didn't get your slides with
all right.
other stuff.
So let me see, how do I get out of this? Too bad you guys don't have Microsoft Teams. It should really be helpful here. Let's see, how do we get out of this? Okay, I'm navigating this and moving towards my slides here. Okay, and I will launch my slides right here, and then I will share them. Let's see how I share. Let's see, how do I share here?
Be on the bottom of the screen. It's a green share screen.
Okay, got it. Okay. Let's see. Okay. I don't see the share here. Let's see. Must be doing something. Okay, there it is, the share screen. Got it. Okay. And share. Can you all see the slides?
Yep.
Okay. Let's go into the slideshow mode here, and we'll try to minimize this. Okay. All right. Well, let's just jump right into this. As most of you know, the initial phase of COVID-19 was around two things: flattening the curve and allowing health systems to not be overwhelmed with the overall amount of influx of patients and demand on the system. And that in many ways has been continued throughout, but we're now starting to recognize that it's more than just that. It's also about how we can restore the economy and bring businesses back to life. So there's a lot going on with COVID, but what we learned early on was that this was unlike any other type of virus or infection that we've had in the past. I mentioned my experience treating patients with AIDS. We didn't have to deal with the massive influx of individuals calling into the system, flooding the ERs and the urgent care centers, and in many ways infecting people just by sitting in the waiting room. What we learned is that the community spread was extremely easy and also something that could happen very rapidly. So when it first hit in the United States, we were on the front lines in large part because, as you know, we're based out of Seattle, and that's where one of the earliest patients was seen. And we recognized that this was going to be more than just simply treating the illness. We needed to manage the population. The number of calls that were coming into the system, and in this case, it was Providence Health System that was on the front lines dealing with this, was tremendous. They were getting overwhelmed, and it was a bottleneck to much of the system. And that was then forcing people to actually just go directly to the ERs. What we've learned is that the AI-enabled healthbot technology could actually enable a more rapid and a seamless screening and triage process. And in that process, we were able to demonstrate a 40% reduction in call volumes. And anecdotally, we saw significant reductions in foot traffic to the ERs and urgent care centers. What you're seeing here is what the initial bot looked like. It was based on initial CDC guidelines and criteria for initial triage. It's then since been updated on multiple times. It's now gone beyond Providence to over 23 countries globally. Over 340 million messages have been sent. The CDC uses it. It's become, in many ways, a standard for how a lot of countries are handling the influx. And it's become an opportunity for us to start that engagement with the individual who may have questions and or concerns. Now, one of the things that will very naturally happen is the individual is deemed to be potentially at risk, or maybe one who could need some lab testing or further evaluation. There would need to be a telemedicine visit. So since they're already in the context of a bot, it was fairly easy to create the APIs to hand off to a virtual care visit. And in this case, it was the Providence virtual care visit. But since then, it's been linked to multiple virtual care visits and platforms. And what we've realized is that that in itself was of significant value and had a huge impact. But beyond that, there were significant issues that we were seeing around limitations of everything from lab tests to ventilators to PPE. And what you're seeing here is one of the studies or one of the reports from the Wall Street Journal on how some of the frontline individuals, these are residents, were not really trained to handle the need to use these ventilators. I mean, many of them were family practice or ophthalmology or dermatology residents being put into a scenario where they had to manage multiple patients on ventilators. And in some cases, it really put patients at risk. And in fact, there were some unfortunate events of patients dying. So what we have learned is that this could very easily have been avoided, and still can be avoided, if we could have had a trained clinician managing those ventilators. And that was something that in a matter of weeks, Microsoft, in collaboration with GE Healthcare, put together a program. And this program was one that took the inputs from ventilators and centralized it to create what we'll call a virtual ICU, in which a trained specialist could monitor multiple different types of ventilators. There's a couple of interesting things about this. One, it allowed us to be able to provide the trained clinician, but at the same time, one of the key benefits was that individuals didn't even need to go into the ICUs and take a look at the ventilators. So reduction of PPE was an incredible side effect. And this is something that we've seen again and again. This program was conceived and launched in a matter of 3 weeks. It was something that we spent a lot of time obviously trying to figure out how to make it work. And in the process of implementing it, we learned a lot of different things, such as the improvement, reduction in PPE, and also the prevention, decreased risk of infection to the individuals. So what we're seeing is this rapid innovation that's happening. It's happening with big companies like Microsoft and GE, and certainly this is the model that you all will be applying. Another area that we started looking at was the whole concept of how can we allocate PPE to those who need it the most. This is a program that ultimately involved multiple stakeholders, including the American Hospital Association, Kaiser Permanente, Kearney, and it involved first the focus on looking at whether or not we could have donations properly allocated to the right individuals or the right hospitals. It's an app-based program called Health Equip, and what we had done as part of that was enable individuals to donate their PPE, and rather than specifying it, I mean, you could specify to a specific region, but more often than that, it would be could be donated anywhere. And then on the back end, there was an algorithm that was developed by Kaiser Permanente, American Hospital Association, to determine who was in greatest need so that these could be delivered. One other key part of this was the last mile delivery, and UPS served as that. So what we've been thinking and recognizing is that sometimes it's not just about technology, and it's not just about the equipment, but it's around the supply chain and making and improving that efficiency. So as you think through these innovations, think about how it actually gets delivered. Delivery of the service is just as important as the innovation itself. Another area that we have been spending a lot of time thinking about are treatment. And as most of you know, convalescent plasma has been used for other types of highly infectious diseases such as Ebola, SARS, and MERS. And what we've learned in that is that the ability to take the plasma from, and specifically the antibodies from the plasma from those that have been previously infected, and combine them together in what we'll call a hyperimmunoglobulin is one of the best ways for us to be able to consider treating those that have this infection, or potentially even preventing it. And so there's ongoing clinical trials to look at how this could be applied. We don't know for sure if this will work. We have a high degree of expectation that it will, but as part of this, this was done in collaboration with the Mayo Clinic and a variety of other organizations in a program called The Fight Is In Us. And in many ways, this is what we'll call a coalition of coalitions, in which these organizations are now working together to be able to kind of figure out ways that we can provide that plasma donation. And similar to what we heard or we used before, again, another very important lesson learned, we can take some of the things, the tools that we know that are working well, the same health bot that was used by Providence Health System, the same health bot that is being used by the American Hospital Association for PPE, and put them in the context of enabling and triaging individuals that are interested in looking for donating plasma for this great cause. So this is another area of great need, but also from an innovation perspective, one in which we're applying some of the key principles. Take what works well and see whether or not it might work in this scenario. As we move towards sort of where we're at today, we're at the point where in many places, organizations or businesses, institutions are looking to reopen. And as you know, it's going to be highly variable. Some states and some businesses will be doing it at different phased intervals. But there are some key principles that need to be put in place. And these principles are listed here on the right-hand side. You've got social distancing and use of protective equipment. You've got potentially temperature checks, need for sanitation, disinfection, limitations on how we do travel. But at the same time, some key recommendations relate to monitoring the workforce. So in looking at whether or not people have symptoms. In an ideal world, it'd be great if we could test everybody. Given the number of tests that are available today, it's unlikely. So we're going to have to go to sort of this next best option, which is asking people whether or not they have symptoms. Doesn't solve it because we certainly know that there are asymptomatic and pre-symptomatic carriers, but it helps a tremendous amount because it allows us to be able to address a large chunk of those individuals and then act very quickly on them. And what we did is, again, similar type of concept, took some of the innovations that we knew that are working well and applied them in a way that employees and employers could use. And so that HealthBot, again, which we saw before in multiple different examples of screening and triage for COVID infection, for PPE donation, for convalescent plasma donations, it is used now in a customized manner to screen individuals for COVID-19. And then in this scenario, if they are cleared, the employer has an app that will allow them to be able to enter into the facility. The unique element of this program, which I'm highlighting here, which is a program that has been launched by United Health Group, and it's called Protect Well, is it also ties in the lab testing piece. So businesses, institutions can actually, for those individuals that have confirmed or suspected infection, can receive a lab test in an expedited manner. And then there's an element of dashboarding around that. So let me kind of show you just what that dashboarding could look like. It's really a key part of probably what we're going to need to start looking at. How our organizations or how's our facilities, how are the regions doing relative to the infection? We are getting data from CDC, WHO. We get a lot of that information in terms of how things are going, where the hotspots are. But recognizing that now as individuals start self-reporting on this and businesses start capturing it, this is also another key data point that could help us in predicting where the next outbreaks will be. And then as we start moving towards this next phase of hopefully where we'll be able to return to some semblance of this new normal, the expectation that this new normal is going to be the same as the prior normal is that that's probably not going to happen. What we're going to realize is that people, organizations will have adopted a digital platform, and we're going to need to start thinking about how patients need to be engaged in the home, on mobile devices, on PCs, using tools that they use every day. And this digital portal will become the new way of engaging individuals. We can use tools such as the bot, we can use tools, search engines, and a variety of other things to be able to capture information or and provide information, I should say, but then also at the same time capture their attention such that we could directly launch into telehealth visits if necessary, enable a faster triage to those services that are necessary. Could be lab testing, could be procedures, could be a clinical evaluation, and appropriate diagnosis and treatment. And ultimately, this provides a framework for how we can provide long-term follow-up. And as we think through these, telemedicine oftentimes is viewed as the doctor-patient relationship. We really need to start thinking about how this same platform can be applied to not just physicians, but to the entire healthcare service community, the nurse practitioners, PAs, the pharmacists, social workers, dietitians, and also family members and other support networks. How can we enable those people to be involved? A lot of times these are important decisions that need to be made in collaboration with people who are caring for them. So caregivers, critically important for especially the vulnerable. And then, of course, there is now the possibility of bringing in the tools that we have seen in the past that's so important in terms of monitoring. These are sensors, these are wearables, these are things around us. Many of these are Bluetooth enabled, could very quickly be brought in, for specific use cases for monitoring, assessment, and ongoing disease management. And lastly, what we want to also recognize is that individuals will, in many cases, need to talk to somebody. So having a digital platform that links directly to, we'll call it a call center, but having that call center set up in such a way that those agents that are responding are also getting the same information about what needs to be done, not just your phone number and I know who you are and where you live, but things such as, I know from your past medical history that transportation has been an issue for you. I'm going to schedule an Uber ride for your trip to the lab test. So this is the type of work that can be enabled through interoperability standards such as HL7 FHIR and open APIs. So I've done a lot of talking. I think it's now time for us to kind of start thinking about what we can do and really begin doing. So thank you very much. It's been a pleasure to talk to you, share a bit about what we're doing. I'm not sure if we want to take questions, but I'll be happy to stick around for a little bit longer.
Thank you so much, David, for spending some of your time with us this evening. People really appreciate what you have to say, and I think really speaks to what in a short amount of time can be accomplished in terms of solving some of these problems. And so, oops. So with that, we're going to move on to the next part of our presentation here, and really focus on the next step that you guys will be embarking on, which is really on the problem definition aspect. I know a lot of you are itching to get into the solution development, but any of those ideas that for David talk about in terms of what they had to be able to do, has really started with ensuring that they've got the problem well defined, and that they've identified who all the different stakeholders that are involved as part of the problem. And so as Albert Einstein once said, if I only had 1 hour to save the world, I'd spend 55 minutes of that defining the problem and only 5 minutes finding the solution. If you don't have that problem well defined, the solution you're going to be building is not going to be truly addressing that problem. So make sure you really spend a good amount of time digging deep into that. And I think so most of you will be spending the rest of tonight through the morning of tomorrow as well in defining. And so what do we mean when we say we want a well-defined problems? And so for us, it's really in three aspects. One is it's a clear and concise statement that really describes that pain point, especially the people who don't necessarily understand or who's not as aware or as knowledgeable about the problem, and really providing it in quantifiable terms. And the reason we say that is because you want to start thinking about what are some of those potential metrics that you could be measuring that quantifies that problem, so that when you start implementing your solution, you have a metric to go after, and you know, you can definitely say, this is what our solution has been able to accomplish. The second part is that it's really a communication. It really helps bring people to really grasp and understand what you're trying to accomplish. You've obviously heard a lot of people talk about, the elevator pitch and so on, but this is a communication tool to help get buy-in and support from others, either people who are experts in the field, but also to people who are not, but who are equally important decision makers, whether they're the economic decision maker, whether they're the policy decision maker. You have to be able to communicate that at all levels. So defining the problem for us really breaks down into 5 areas. The who does the problem really affect? Who's the end user? Who's the customer? Who's really experiencing that pain point? The what, which is what is the actual problem? And dig this down as deep as you can. Essentially, not just what the problem is, but what are the consequences if you do solve that problem, you don't solve that problem. And what are the shortcomings of the current approaches to sort of solving that problem? This is part of you doing your market landscape research, and not just from established solutions that are out there, but because of a lot of the innovative efforts that are happening out there, what else is slowly surfacing that will need to be addressed? When does a problem occur? So this is everything from when in the user journey of the problem, when in the disease journey or problem journey that these problems occur, essentially. Really figure out in that spectrum of time, where are you looking to have that impact? And then the where. Does this problem occur in the patient's home? Does it happen in the hospital? Does it happen out in the community? Because the solution for the same problem across different ecosystems, even whether it happens in the United States versus Africa versus Europe, really hone down into that component as well. And of course, the most important question, which is the why. Why is it going to be such an impactful problem to solve? So, as Esther mentioned in her talk, don't focus only on solving short-term problems, but finding those short-term problems that have long-term longevity as well, that give you a runway, a pathway towards fixing a short-term and a long-term problem. The stakeholders that you should be thinking about are really, we say the 5 Ps: the patients, the providers, the payers. We say pharma industry, but really the private sector. But this part, not just the patients, but that circle of trust. Their caregivers, their family members, their friends, the people who are having equal buy-in into it. And last 2 thoughts: be very quantitative, as mentioned. Pick a very specific end user or customer to start with. And you don't have to end there. Just start there and start developing your problem and your solution around that. See where it leads you. If it goes down the right pathway, then continue with it. But if it doesn't, you can certainly switch to a different end user or customer. But build that persona so that people, again, who are not readily in tune with that particular problem can quickly grasp and understand the problem you're trying to solve. And then don't confuse who's your end user, who's your economic buyer, especially here in the United States, where in North America, and most, the person who is prescribing the solution versus a person who is using the solution versus a person who's paying for the solution are 3 different stakeholders that you have to figure out what are the incentives for each of those stakeholders, and how do you align them into the solution that you're trying to get. So just a reminder, the 4 steps of identifying the problem, breaking it down, building it up, and making it better. So how is team formation going to happen? And each of the tracks I will split up in shortly, each person will get 45 seconds to pitch the problem. You will then have an opportunity to essentially jump into into individual side channels that are around each of those problems, talk to other team members, and highly encourage you to shop around. Also highly encourage team leaders to don't form your teams too quickly as well. Allow the opportunities for people to explore other teams as well. I know you're all anxious to get started, but you really want to build the right team, not just the first team that coalesces around you. You should aim for 5 to 7 people per team. We have a very hard cutoff at 7 people per team. And this is very intentional, and really focus on getting those different backgrounds that we discussed earlier as well. And so the judging criteria really falls under 4 areas. And again, this is largely for tracks A through H, where the new teams will be forming. There'll be a different judging criteria for tracks I and J. But the 4 criteria will be: 1 is on the impact. So how well have you defined the problem? How important and impactful of a problem are you looking to solve on? The second is the innovation, which is really how innovative, how unique is the solution you build it, and how well will it truly address the problem that you're looking to solve. Taking into account not just the technical component, but really the context, the service delivery, the potential resource limitations of the ecosystem you're looking to implement your solution. And the implementation part, or the viability or feasibility, so to speak. Have you built up enough of a proof of concept, a prototype that has been tested and validated with users so that we can believe and have credibility that your idea has traction? Is it a sustainable and viable and feasible solution as well? And then the 4th part will be, of course, how effective your presentation will be. And so as I mentioned, being able to communicate all the great work that you've done this past weekend is just as important as well. And so tomorrow, I think at 1:00 p.m. Eastern time, we'll have a How to Pitch session by David Beckett. So certainly taking courage of that. And then, of course, as I mentioned, the diversity of backgrounds is going to be also part of the judging criteria. And then with that, just as a reminder about the code of conduct, be nice. You remember that a lot of this has been built under the open source license for the ideas that get developed out of this weekend. Just also a reminder that all of you also agreed to photographs and videos that will be taken of the Slack workspace or of the sessions that we've had. So be mindful of that as well. If you don't agree to this usage, then certainly do not participate in this event. So with that, I'll turn it over to Hannah to quickly run through some of the logistics before we split off into our respective tracks.
Yes. Hi, everyone. Since I skipped my introduction at the beginning, I'll just do it now. My name is Hannah Wright, and I work as a research engineer at MIT Lincoln Lab, and I'm on the organizing team this weekend helping out with operations. So I know all about your weekend agenda and what you guys will be up to this weekend, and it's exciting. So let's go to the next page. So we're trying to, rapidly move from problem to solution. So today is all about problem pitching and ideating and thinking about what you want your big goal to be. So today we're going to do problem pitching right after this. So be sure to check your track channels, because the Zoom links for those will be in your track channel set by your track leads. These will be via Zoom on track, and then check Slack for details. Team formation will happen after the problem pitching. Once again, that's just, it's going to happen very organically. Your track lead will explain all of this during problem pitching, so no worries, no stress, everything will be okay. And if you have any questions, always reach out to your track lead. So tomorrow morning, mentors will come online, and then we'll have a how to pitch. The mentors will come online about 8 a.m. and then we'll have a how to pitch seminar tomorrow with MIT professor David Beckett. Is he? Maybe?
No, he's not.
Okay, he's not an MIT professor, but with David Beckett, and who will be kind of explaining how to pitch and what you should make your final pitch look like. And so we encourage everyone to attend how to pitch, and we encourage everyone to do the practice pitches, which is where we can receive feedback from communications and subject matter experts. It's really important that we do this because you have to speak about it, especially getting used to talking over Zoom. It's just best to talk about it, and it's best to try and give your pitch, even if it takes 6 minutes the first time on Saturday, and then if you do it again on Sunday, it's better. The judges are the mentors that will be listening to you during these practice pitches are amazing and will be able to give you some really great feedback. So we strongly, strongly encourage that every team signs up for at least one practice pitch. And practice pitches will also happen on Sunday morning, 8 a.m. to 10 a.m. Once again, this is your last chance for feedback. Your final presentations will be due at 11:30 a.m. that morning. And those will be due by, you'll submit them via Google Slide. Your track lead will keep you in the know about all of these things. And then Sunday afternoon awards will be announced. Great. So yeah, I kind of already gave this breakdown here. If we want to go, Yep. And then participants, if you have any questions throughout the weekend, make sure to refer the participants guide. So if you try your track lead, or if you try to message someone, we're getting a lot of messages. So first and foremost, please try and go to the participants guide. That will probably give you the quickest answer. So go look there. That's a great toolkit. We put a lot of resources together for you guys. So if you're not reading it, you're missing out. So be sure to check that out. And we're really excited for everyone this weekend to be hacking and to hear everyone's presentations. And as always, if you have any questions, reach out to us. And we're looking forward to any last comments, Freddie?
Thank you so much, Hannah. And just as a reminder, this participants guide is a living and breathing document. We're constantly updating it throughout the weekend, especially as new questions come up. So please, if you have any questions, check there first. It's most likely that somebody else has already asked it, and we try to answer it or address it. Similarly to the questions for organizers channel in the Slack as well. Try to at least scroll up a little bit and see if your question has been asked before re-asking the question. And also to our partners and mentors as well, you also have your own mentor guide and partners guide as well that we've shared with you in the respective channels. So with that, I'd like to again thank our keynote speakers, Esther Dyson and David Rue, for joining us this evening. Of course, to the entire entire organizing team from the MIT COVID-19 Challenge, and especially for this event. And with that, we will end it here and split into our respective tracks. And so if you go to your Slack channels, to the tracks you were assigned to, all of the track leads will be communicating with you the Zoom link and information of how to join the Zooms for your respective tracks to do problem pitching. And so we'll probably shoot to start around 8:45 p.m. So it'll give you guys about 12 minutes to take a little bit of a break, but then to quickly migrate to your Zooms. Thank you, everybody. I'm looking forward to seeing what you guys accomplish this weekend.